Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. In this video today, let's talk about kids, schools, and our window of opportunity. So first, what we know about children and what we don't know. And when you hear conflicting reports, it means we just don't know enough yet. So kids do get infected. The national average is around 9% of cases in kids under the age of 17. In North Carolina, that's about 11%, and in Haywood County, it's about 8%. We know their symptoms are mostly much less severe than in adults, and there are lots of theories about why this may be, but we really don't know. There was a study from South Korea which showed that kids harbor large amounts of virus, even little kids. And the study also found that children older than 10 transmit about like adults do. Less than 10, less so, but it's unclear how much they still do transmit to others. There have been a few case studies with small numbers of kids where contact tracing of an infected child has not resulted in outbreaks. Now, this is different from flu and every other virus where we know it's widely transmitted from children to adults. So is SARS-CoV-2 different, and why? We don't know. We have seen what has happened over the past month across the U.S. in terms of the increased number of cases in children, and we've now seen schools in Georgia and at UNC Chapel Hill with infections and closings. There have been around 350 children in the U.S. who have gotten severe illness requiring long hospitalizations, time on a ventilator, and unfortunately some deaths. Again, small numbers, unless it's your child. There's plenty of evidence that many kids are not faring well without being around other kids. Some are doing fine, but others not so much. And we have the experience of many daycares that remained open throughout to care for children of essential workers, including right here at Haywood Community College, where they had no infections, and we can learn from that experience. Other countries have been able to open their schools with pretty good results, and each has used their own mix and match of public health measures. But those who have done well have largely been from areas of low prevalence of infection, somewhere between below a prevalence of 5 to 7 per 1,000 population. So right here in Haywood County, we're right now at about 6 per 1,000. So some have suggested also an average rate of 1 new case per 100,000 population per day as a safe threshold. In Haywood County, we were at 29 a couple of weeks ago, but now we're down to 6.4. So here's what we know. Kids are not immune. They seem to get it less and in less severe numbers, but they do get COVID. They're much more likely to get it at home than to give it to others at home. And it appears older kids transmit like adults. Younger kids, we don't really know about yet, but maybe not so much. Success opening schools is related to what's happening in the community. And what's happening in the community revolves around what people are doing. Success remaining open hinges on the school and parents working together. These have been the experiences elsewhere. And I think it's fair to say that everyone who wants schools to be open wants schools to be able to remain open. And I think also it's fair to say we don't want to put anyone at any more risk than necessary. And yet, there are no school policies or procedures that will make this risk zero for children, teachers, or staff. Controlling spread in the community is really what's key, and that's up to each of us and every one of us choosing to do or not to do. And here's a bottom line measure you can take. Avoid being a close contact with anyone. So if you come in contact, you don't have to quarantine and mess up the rest of your life. So what does that mean? A close contact is being within 6 feet for more than 15 minutes without a face covering. So what you want to do is protect others from being in your cloud and stay out of someone else's cloud. And that's the way to keep spread from happening. To do this, avoid crowds, distance when you can, wear a face covering when you can. It's just that simple. Now, for the benefit of others, if you do get sick, test and isolate right away. And if you have a close contact, then quarantine from others. We have a window of opportunity right now to drive the cases down to where we want to be. Below 6 new cases per 100,000 population, we're almost there. Get it down to 1, and we're in good shape, not only for now, but for the next spike that may come. And if we can keep it there by what we do, then we've made our community a safe place. So keep doing what you're doing. And if you aren't doing, now's the time to give it another thought. What you do really matters. So be well and be careful, especially right now.